This is Dr. Janani, ENT and facial plastics. So here we have with us a 43-year-old male who's planned for functional endoscopic sinus surgery. So he has come with a complaint of facial pain and heaviness for the past 5 years, especially his cheek, the maxillary sinuses. The scans will be followed up by this. So he's got facial pain and facial fullness for the past 5 years, and he's also got nasal blockage, left more than right. And follow-up scans has been done. He's got left-sided inferior turbinate hypertrophy and bilateral maxillary sinusitis and a little bit of ethmoid sinus, so which we are planning to do a functional endoscopic sinus surgery. So this procedure is completely done endoscopic, wherein no scars or no incisions from the outside. It will be done with an endoscope and a camera, and the patient is good to go and resume his duties like 5 days later, where within 5 days we'll remove the nasal packs, and yes, he can resume his duties after 5 days. So this is a very simple procedure, yet a very effective one. So now we'll proceed with reading the scan of the patient to understand better on what we are planning to do and what is the outcome. So we have the scan of the patient, and this shows both maxillary sinus, chronic inflammation around the sinus, so chronic sinusitis features of that, especially on the left, and there is a maxillary polyp on the left side. So as we progress, you can see a little more anteriorly, there is a left inferior turbinate hypertrophy, minimal posterior septal deviation on the left side, which can also be corrected. And middle turbinate seems to be fine. There is a little bit right-sided concha, which is okay, but it's not obstructing the airway. So we are seeing a completed picture of a FESS surgery. So this is the immediate post-operative result, where we can see a good left inferior turbinoplasty done. Left maxillary ostium has been opened and it has been widened. A good pear-shaped maxillary ostium is what has to be achieved at the end of a wide mecha anterostomy. That has been done here. The sphenoid ostium has been opened. This is an accessory sphenoid ostium that has been opened up, and the patient had lot of polypoidal mucosa, nasal polyps in both the maxillary ostium and the sphenoid and ethmoids. So both have been opened. And this is the left side. Left side same has been done. Inferior turbinoplasty has been done. And left side also we have opened up the maxillary ostium. Minimal polyposis was seen on the left side. So this is a completed picture. All ethmoids have been opened up. So FESS is a very effective procedure for patients who have nasal polyposis and as well as chronic sinusitis, rhinosinusitis.